What are the classifications of hydrocephalus? Usually, it is classified according to the radiological findings and the clinical presentation. Obstructive, non-communicating hydrocephalus and non-obstructive communicating hydrocephalus. This will be evaluated through the CT or MRI. Could be present congenital early in life or acquired later on. So, in obstructive or non-communicating hydrocephalus, it results from an obstruction to CSF flow causing enlargement of only those ventricles proximal to the obstruction. So here in the upper MRI, the third is dilated, but the fourth is not. Communicating or non-obstructive hydrocephalus results from unsatisfactory absorption of CSF by the arachnoid granulations or overproduction of CSF by choroid plexus. In the lower CT, there is dilatation of both lateral ventricles, the third and the fourth in case of communicating hydrocephalus. What are the causes of obstructive or non-communicating hydrocephalus? Either present at birth congenitally or later on acquired. We can have aqueductal stenosis or stenosis of the aqueduct of Sylvius. This can be congenital, inherited as X-linked recessive, or acquired aqueductal gliosis results from meningitis or arachnoiditis. With congenital obstructive aqueductal stenosis, the fourth ventricle in the red circle is normal, it is not dilated, but the lateral and third ventricles in the lower image are dilated. Another inherited or malformation causing obstructive hydrocephalus is Arnold-Chiari malformation. It is a structural defect in the brain and the spinal cord causing associated with meningomyelocele, a defect in the back. The lower displacement of the medulla through the foramen magnum will result in the hydrocephalus. The defect in the back and the presence of meningomyelocele, if associated with spinal dystrophism, depends on the level of the defect. Is it thoracic or lower? The higher the defect, the more the damage. The larger the segment, the more the damage. This will lead to lower motor neuron signs in the lower limbs and reflux nephropathy with progressive hydronephrosis and end-stage renal failure at adolescence usually. Dandy-Walker malformation or syndrome. It is cystic expansion of the fourth ventricle and prominent occiput and or cephalocele. Lastly, brain tumors. The common example in children is medulloblastoma, which is a posterior fossa tumor related to the fourth ventricle. It will lead to obstruction and dilatation of the third and the lateral ventricles. It is a midline tumor. In this CT, there is dilatation of both lateral ventricles with the tumor as a white mass in the cerebellum. The other type of hydrocephalus is non-obstructive or communicating hydrocephalus. All the ventricles are communicating as the obstruction is outside the ventricular system. So all the ventricles will be dilated, both lateral, third and fourth ventricles will be dilated. Causes include subarachnoid hemorrhage is one of the most common causes. Meningitis, particularly pneumococcal and tuberculosis, will cause communicating hydrocephalus, also intrauterine infections, torsion infection, and leukemic infiltrates.